Okay, today in this video we're going to talk about the knee, okay? And we can't talk about a knee in isolation to what it's above, which is the foot. Sadly, this knee is for a left leg and this foot is for a right leg. So you have to just bear in mind, here is the tibia, here is the fibula at the side of your leg on the outside edge, the lateral edge, and here is your tibia and here is your fibula. Okay, so these bones, the tibia goes all the way up to here and is the main bone that comprises the knee joint, and the fibula at the side is as a separate bone. This shouldn't be counted as one unit. It is a separate bone which, when you're walking on uneven surfaces, walking the dog, going in the fields or whatever, as well as striking properly when you're walking, this fibula and the tibia should be articulating against each other like this. And what often happens with people who are walking in, say, Wellington boots and things, they are gripping their toes like this, not even aware they're doing it because one foot may be slightly smaller than the other foot in Wellingtons and they're moving about. And as they grip that, they risk solidifying in here. So the tendons that actually pull the toes up, and 3 of them come up here to this side of the knee, and 2 come up this side to this side of the knee, the tendons run all the way up, but as this starts to become rigid, as people are walking and gripping their toes, they can end up losing this mobility in these 2 sections here. And where that can have issues, for instance, is into the knee. It's not the only thing that can cause issues into the knee, but it's very useful to have a perception of what a knee is, because people think a lot of these joints are really quite complex, and they're not. So here is a knee. This is your main upper leg bone, femur, that goes all the way up and into your hip. And this is your main tibia. And they have a crescent-shaped cartilage on each one that allows them to do this as you walk. And floating in front, on top of what's called a fat pad, is a patella or a kneecap. And the kneecap protects you when you want to kneel down. It isn't actually fastened here, it's floating. And it actually can move around and it can slide and it can go into different parts of the body. Sometimes I don't mean, it won't go into your stomach, but it can move about, okay? Because it's held there, all of this is by soft tissue. So if we turn this round, this is the outside, this is the inside of your leg here. Your hamstrings attach up here, and when they come down here, one set of strands goes one way, one set of strands goes the other way. Okay, so you've got, if we're being technical, semimembranosus, semitendinosus, and biceps femoris. We've got those coming down here, but they don't end here. And that's another thing that people need to bear in mind. They don't stop at the knee. Yes, that those tensions come down here, they attach here that allow for you to bend your knee, but they actually continue continuously into what are called the gastrocnemius, or your calf muscles, and continuously into the Achilles. And on this inner edge here, you've got these adductors, as they're called, gracilis and adductor magnus and so on. You've got all these on your inside edge of your legs. At the front, for instance, you've got your quads that are all attaching to the front of your pelvis and coming down here. So sartorius and vastus lateralis, vastus intermedialis, etc. So they're all coming down at the front. And then on this outside edge, you've got things like your, the outside edge of your leg here, you've got your IT band and your tensor fasciolatus. So you might know that as ITB or TFL and so on. So what you've basically got is all of these tensions that come down the different sides of your leg. Some of them wrap across each other, like sartorius wraps across and so on. And they allow this structure to be held. But what you can end up with is one hamstring can be too tight. So you could have, from your sitting bone, which we've talked about here, your ischial tuberosity at the base of your butt cheek, basically, you can have, as we palpate as a bone practitioner, and we palpate down, we may find that one set of fibres are too tight, impacting the knee. So imagine it's in the hamstring area, and it's coming down onto this inside edge. As the person is then walking like this, instead of being equidistant, running on all the cartilages, it can be over tightening on one side. I don't know how well that's coming out on the video, but if we do that, you can see that this bone is misaligned with this bone. And therefore it's wearing away, and you can very quickly end up bone on bone. And bone on bone can then give rise to osteoarthritis. What is arthritis? Itis means inflammation. Arth means joint. So when we don't look at the individual types of arthritis, we simply look at what the word arthritis means. We mean inflammation in a joint. Now, some people would say, take an anti-inflammatory to stop the inflammatory process. But we would think, why is it inflaming? It's inflaming because it's trying to make itself better. It's sending in the army to try and repair itself. So we're saying, right, it's getting inflamed here. We might feel it's hot. We might feel all sorts of different things going on. And we're interested as Bowen practitioners in stopping it inflaming, if we can. We might not be able to. It might be an autoimmune response where the body's turning in on itself. But the first thing we're looking at is really biomechanically is, why is somebody got pain on the inside of their knee here? What is holding it so that it wears too much on this side? How can we restore the space correctly so that it functions correctly? So we're looking for, where are the tension lines, having a conversation effectively with the body by influencing those tensions so that this tension becomes normal tension. Suddenly it is now rocking correctly back, and suddenly there is no arthritis anymore. We haven't cured arthritis. We have stopped a joint, from being inflamed itis by restoring the tension lines running through the body.